to the clinical podcast series brought to you by the American Academy of Optometry Foundation. The topic for the episode for today is evaluation of optical coherence tomography angiography parameters in patients treated with hydroxychloroquine. I'd like to thank our host, Dr. Mila Brujic, our topical expert, Dr. Shaleen Ragha, and our topical editor, Dr. Kat Hogan. And now it's my pleasure to turn it over to Dr. Brujic.
Hi, I'm Dr. Mila Brujic. Welcome to the American Academy of Optometry podcast series. And I'm joined here today by Shaleen Ragha. Shaleen, if you could share with the group just a little bit about yourself, please.
Yeah, I am full-time at Southern College of Optometry. I practice in the clinics associated with the school, and we will be discussing the article on evaluation of optical coherence tomography angiography parameters in patients treated with hydroxychloroquine.
This is such an interesting topic because, again, we're just using OCT angiography more so in our practices. So why is the topic of this paper important to optometrists? Like, can you kind of explain that and break that down?
Yeah, OCTA is kind of a new modality in optometry, and we're just finding more and more conditions that we can use this platform to evaluate patients with. Hydroxychloroquine being a drug that a lot of our patients are on that can cause retinopathy, it's important that we use these tools to identify patients with retinopathy sooner.
So here's what we're all waiting for is summarize the article for us. Give us some of the key findings that they found in this article in particular with relation to OCT angiography.
Yeah, so this study, it showed that OCTA can show reduced perifoveal vessel density before they show thinning on OCT or even paracentral defects on a visual field, specifically in the deep vessel plexus of the macula. So you want to consider OCTA on all patients that are going to start, or are currently on hydroxychloroquine, but specifically rheumatoid arthritis patients on hydroxychloroquine may show earlier damage on OCTA than any other test.
That's interesting. So, Shaleen, are we to now assume, is this the new standard of care, or is this really at the point where it's been researched, it's been shown that you see early vessel density reduction, and we should at least be starting to monitor it at this point?
Right. The 2016 protocol developed by American Academy of Ophthalmology did list OCTA as one of the platforms, but really OCT and visual field were the only ones that were really harped, as there were enough studies to show that signs will be seen on that. This is one of the first studies that looks at OCTA in comparison to a multifocal ERG, seeing that patients who don't have any signs of visual field defects or OCT thinning are showing early signs on OCTA and multifocal ERG.
So again, the bottom line here, Shaleen, is we're going to actually see changes sooner in that plexus than we will even with standard OCT, like high definition OCT cross section, correct?
Exactly.
So how do you feel that this is, when you're looking over the next 1, 5, and 10 years, like how do you see this really influencing the practice of optometry and how we care for these patients? Do you foresee new software packages analyzing this? Um, how does this become truly clinically applicable in standard care?
Yeah, well, a lot of OCTA platforms, or a lot of OCTAs now have platforms for glaucoma to follow micron changes over time of that vessel density. And so, in the same way, you can utilize that for patients on hydroxychloroquine. Not all practices have an OCT, let alone an OCTA. So, this is encouraging to purchase those types of tools for your practice if you're seeing patients that are on hydroxychloroquine.
I think this is so great because whenever we can detect change earlier, I think it's always beneficial from a patient's perspective because, as we both know, this is an absolute contraindication if we start seeing some of this toxicity. So the earlier that we can catch it, I think the better the patient's visual outcome is. Shalene,
Right.
this was awesome. I really appreciate you summarizing this. You did a beautiful job, and thank you for being on this episode of the podcast. We'll make sure to have you back on the show.
Great, thank you.
And thank you all for joining us on this episode as well.
And a special thanks to CooperVision for their educational grant to make it all happen.